So we're looking at part 20 of hydrotherapy theory and practice, and we're looking at various ways that we apply the concepts of hydrotherapy when we're assisting others. And as we move into this, just a reminder that any type of health challenge that you might encounter, it's always recommended that you partner with someone who has a similar philosophy of care that you do as far as taking care of yourself. And that the things we talk about here are just extra tools in your toolbox that you can use and pull out when needed, and keep them handy for reference. It's not medical advice, just different tools, and anything that comes along that is said to give a benefit to health, you should always check it out and do your own due diligence. The Newark Advocate posted a quote by Thomas Edison back in 1903, saying that the doctor of the future would be practicing medicine in a different way than they do. That is, instructing the patient in the care of the human frame, in diet, and in the cause and prevention of disease. It doesn't seem like we've really met that mark at this point in the general sector. There are individual sectors, but I think that there has been a philosophy that has degraded that far-reaching and far-seeing idea of the way medicine should be practiced. But even before that, it was mentioned in Counsels on Diets and Food and Testimonies for the Church that there are many ways of practicing the healing art, and there certainly are, but there's only one way that heaven approves. So that's pretty solitary. That's a very direct, pointed comment there. And those are the simple remedial agencies of nature that won't tax or debilitate the system. So they have powerful properties the way that other healing arts are practiced, but they're not the way God ordains. Pure air and water, cleanliness, a proper diet, purity of life, and a firm trust in God are the remedies for which the want of thousands are dying. So they do take skill, as we've been learning here in our hydrotherapy practice and theory. There is a lot of different components to it and a lot of different ways to apply a given type of treatment. So we have to spend time learning about them, and people don't appreciate we're in our quick fix society, our instantaneous have it now kind of idea. And we don't take the time to learn things the way we need to. And that needs to extend to both our spiritual life as well as our physical life. So the outlay of expense is expensive for both monetarily and taxing on the body for the drug paradigm of allopathy. 3 John 1 verse 2 says, "Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers." So that's another aspect of our whole well-being and wellness is taking care of our soul. And that's what we do each week when we discuss things of a spiritual nature around Scripture and the Bible and spirit of prophecy. Those are important components to garnering and guarding and taking care of our soul. Romans 12, 1 and 2 said, "I beseech you, therefore, brethren, by the mercies of God." So that's how we do it, by God's mercy, that we present your body a living sacrifice, not a dead, dying sacrifice, a living sacrifice, holy, that's sanctified, and acceptable to God, which is your reasonable service. And do not be conformed to this world. Oh, how many ways there are to be conformed to this world. But be transformed by the renewing of your mind, that you may prove what is that good and acceptable and perfect will of God. That's a high charge and a high calling. In the ministry of healing, it was noted that the knowledge that man is a temple for God and a habitation for revealing his glory should be the highest incentive to the care and development of our physical powers. We are fearfully and wonderfully made, and as the Creator has made us in the human frame, he bids us make it our study. Make our bodies our studies, how they operate, how other people's bodies operate. We need to understand its needs and act our part in preserving it from harm and defilement. So today we're going to look at some different packs, a hot trunk pack and a localized hot blanket pack on the body trunk only. So it's not used on the limbs. So the arms and the legs are not included in this hot trunk pack. So you're looking at the torso specifically for this application of hydrotherapy. So the benefits, very similar to the use of the hot pack, blanket pack, which we've discussed previously in episodes 18 and 19. If you have gastrointestinal issues, it can help pain relief for upset GI, kidney pain, bile, playing the bile duct, so the gallbladder and bile can be helpful for mitigating those issues. So the application, you want to begin with warming the individual who's being treated with a hot foot bath. That's always the best way to start, with a hot foot bath. And then continue that hot foot bath throughout the treatment. The torso, you're going to want to wrap with dry fomentation cloths. And then you're going to use hot, wet blanket that's been wrung out. You can use a wringer washer. It's probably the most effective way to do a hot blanket because they're so big. You can just get blanket elbow pretty quick. If you're trying to do the twisting with your arms and your wrist, you might even need a partner to do that. So using a wringer washer, if you have something like that, that would work better. In another alternative might be using a mop squeezer, like custodian's mop squeezer. You can maybe squeeze out enough with that. But a wringer washer is going to wring it so there's not any dripping water, and that's how you want to use that wet blanket pack, however you're using it. So it's very moist, but not dripping. So wrap that hot, wet blanket that's been wrung out from armpits to pelvis around the torso. You want to wrap the entire body with a dry exterior blanket. Once you've done the application of the wet blanket, that's going to keep any drafts from coming in and unnecessarily cooling. So again, you've got the feet in a hot water bath. In addition, you want to wrap it tightly around the arms and legs. So you can see the bottom picture is a hot blanket pack. This would be a whole body hot blanket pack. The way that the chest pack will be differentiated is when you take the outer blanket off. It's just going to be the moist part is just around the torso, as opposed to a full body blanket pack. It's going to be around the arms and the legs as well. So in here, the individual you're working with can have their knees bent so they can actually be in that water basin. You see there, the attendant has a water basin right next to them there on a short table or a box. I'm going to place a hot water bottle on the abdomen, so that's going to help extend the heat. And then you can, on that folded blanket on either side of them, nestle two more, one on either side of the torso. And that should last about 20 to 30 minutes. One thing that you do want to be very careful of is following the procedures for water bottle filling, making sure that the air is burped out of it, make sure that the seal is adequately sealed in, because there are reports of people having hot water bottle burns. Another thing to just keep in mind is not putting excessively hot water in those bottles. So it's basically to help extend the heating time of the blanket pack, but you want to be careful that you don't overdo the heat, so you don't have temperatures to the point where they're going to be scalding if it should, and also having, a dry blanket in between, so you're not having just that rubber surface in direct contact with the skin. That's just not a good idea. So when you get finished after that 20 to 30 minutes of heating, finish with a cold friction rub. So there are mittens for that. You can use a cold towel, and this would be not given if the treatment is given for pain. Given for other reasons like GI upset in general, other than pain, then do the cold friction at the end to kind of finish off the whole treatment. So an extension of this then is isolating either the leg treatments, so a hot hip or leg treatment pack. This is useful in the pelvis area, particularly the hips and the feet. It's a very effective derivative treatment. So basically what that means is you're moving the blood away from an area to an area. You're drawing it to an area from an area that's congested by creating vasodilation in a place that is away from the area that's congested. And that will draw the blood away from that area that's having problems. So it helps get the blood circulating. So the hot, wet, and dry blankets, you're going to have them applied from the hip bone on down to the feet on a leg. So it wouldn't be on both legs necessarily, although it could be. But if you're specifically working on a particular limb, then this could be extended to the arm as well. But this is a particular application to the leg. So the hot water bottle at the feet in the folds of a dry blanket, and then a hot water bottle between the legs. And what that'll do is that just helps extend the heating process of the pack itself. Again, this is going to run for about 20 to 30 minutes. And of course, you can get hot water bottles in different colors and sizes, and you can get sweaters for them too, so you can have additional insulation if you feel that's necessary. Again, you want to be careful that you don't have them leaking. You want to make sure they're properly closed, and a sweater can be helpful for that, especially if you're working with someone who isn't able to communicate with you really well, someone maybe who is a different language, or a child, or someone who has dementia or can't speak, like if they're in a coma or something, or some other reason that would predicate their communication with you clearly. You want to make sure that you have additional insulation, and it may take a little bit longer for the pack to react, but you want to mitigate a burn rather than having that possibility. So the heat draws blood away from the congested area. So this is a circulatory diagram of the capillary networks in the blood vessels going from the heart to the lungs. And you can see that there is a pulmonary circuit, which is the one that's primarily described here, left and right lung. And you have the net going across through the upper torso. And then there's a systemic circuit, which goes to the rest of the body. And it's just been shortened there for the brevity of the diagram. And that would extend down into the lower torso, legs, arms. And then the pulmonary circuit would go around, or the rest of the systemic would go around and go up through the carotid arteries and up into the cranial area, up in the head. So vasodilation is essentially what the heat does. It expands those blood vessels, draws blood to the area, aids the movement of the blood through any given area. If there's an occlusion or a restriction of some kind, it helps open it up. So nitric oxide is one of those things that does that too. And we can get that from beet. Use of beets as a nitric oxide, a natural source of nitric oxide. Our bodies produce nitric oxide. It's actually I think it's referred to as a not a neurotransmitter. It's considered maybe has some hormonal type activities. It was one that was really hard to pin down in the class that it's actually involved in, because it is a gas, and it's made on demand, and it is gone as soon as it's formed. So it doesn't hang around a long time. So it was a rather interesting thing to tease out when they were discovering the role of nitric oxide. And it functions in vasoconstriction, vasodilation, mostly dilation, in its absence, vasoconstriction in blood vessels. So it helps move the blood around. And a cold mitten friction is the way to finish that off again, starting with the other limbs that aren't being affected or being treated, for example. So if you're doing the right leg, you would start with maybe the right arm, left leg, and then finish off with the treated leg. So that helps keep the blood there in that extremity away from the other areas. So we want to look at some different applications here. So the hot leg pack, continuing. So the feet, legs, and half or more of the thighs. You want the same but less effective benefits. Useful when you're using the pelvic immobility is desired. So you're going to be, someone has a broken hip or something like that. You don't want to be moving the pelvis around. You can do the lower thigh and feet and legs, as opposed to doing the whole all the way up into the pelvis. So here's the ringer washer application. They are antique ones. This is a modern one. Basically, you have two tubs that is between. You put your blanket into those rollers, and the handle draws it through. You just want to be careful you don't draw your fingers in there too. The nice thing with the hand crank one, you can back it up. If it has a motor on it, that can be bad news. So just be careful with that. But that can dry it out, and it's going to come out wringing the water into the water wash tub on one end, and the other side is you're going to cut this matted, felted like mass of blanket, which is not sopping wet, which is the way you want it to be. So hot wrung out blanket, wrap that around the leg to the foot, not including the pelvic region. So down below, the dry blanket is covering over the leg and the body. And again, you're going to use hot water bottles to help extend the time of the heat of the blanket. So that's the primary role of those hot water bottles. Then again, conclude with a cold friction. as we have in the other packs, cold mitten friction or cold blanket friction. And again, it's a 20 to 30 minute application period. So it can also include abdominal fomentation to include more area in that time. But again, this would be used if you were particularly attempting to affect an area without mobilizing the hip. So an ice bag with a hot pack. So this is a very powerful way to derive in hydrotherapy. Basically, derive is meaning to move the blood around from one place to the next, so drawing it from one place and moving it to another. And it basically aids the movement of the blood that's congested or slowed down or stopped. Just think of freeway. It has all the traffic slowed down and everybody's sitting still on the freeway. That's a blockage. If you think about the freeway system and the blue movement of blood, it's a very similar kind of a picturesque viewpoint. So even deep tissue organs can be aided by this. And they can pull excess blood from an organ that is congested. Kidney, stomach, pancreas, whatnot. So the benefits, it helps to reduce internal congestion and help to relieve inflammatory pain. So someone with a kidney stone or nephritis, which is inflammation of the nephrons, can maybe derive benefit from using this ice pack and hot pack combination. So it helps to relieve circulatory congestion, and the ice bag drives away the blood, and the cold mitten friction keeps it moving and keeps it close to the surface. And it helps relieve general circulatory congestion. So it may be used in conjunction with any of the hot blanket packs. So you're using maybe a torso pack. You can include the ice pack along with that in a specific area. If you have an area that is of particular concern, you can accelerate the pumping essentially of the blood by using the hot and cold through those areas. So place the ice over the congested area, say over the appendix, if that's a place that is painful. Hot blanket and ice in an acute infection stage. Only. So the hot blanket and ice in the acute infection stages. So that's important. So the acute infection stage is like, for example, appendicitis. It would be acute. So some issues that are aided that aren't necessarily acute. So mastoiditis, the inflammation of the mastoid. So the picture below shows the mastoid bone. There's an infection there. It's manifested by a soreness and a redness on the exterior behind the ear. So it can help with that. So you're using the hot hip leg pack to essentially draw the blood from the head down into the leg area. So that what it's doing is drawing it away. The ice bag can go over the carotid artery and an ice cap and the fomentation to the mastoid area. So the fomentation would be a hot fomentation. So you're using the hot and cold in conjunction to move the blood around. An alveolar abscess. So the alveola are essentially the sockets for the teeth in the jaw. Another word for alveolar is the alveoli of the lungs, but this is a different alveoli. It's in the teeth sockets. So similar application to that of the mastoiditis, only you're focusing on the jaw as opposed to the area behind the ear. Kidney congestion also can be helpful. So a hot trunk pack or a full blanket pack, and you're going to be placing that ice pack over the lower third of the sternum. And that's going to help move the blood from an area of congestion to an area that is away from there. Inflammation of the peritoneum. So the peritoneum is essentially the membranous linings on the interior of the abdominal cavity. And there are a variety of different causes and symptoms. You're going to use the hot leg pack and leg pack by itself, and use the ice compress or ice cap to the abdomen itself. The inflammation of the peritoneum can be very deadly. So you want to make sure that you have proper care for that type of a situation. It can be bacterial based. There could be an organ perforation that has allowed bacteria or other things to get into the abdominal cavity. because normally you shouldn't have anything in the abdominal cavity except for not synovial fluid, but it's going to be a fluid like that. It's basically a fluid your body produces that helps the organs to slide around inside your cavities without sticking together. So pleurisy is where the membranous lining that goes around the lungs has an inflammatory situation between it and the lungs, because your lungs are supposed to slide up and down easily inside your cavity. When they're inflamed in pleurisy, for example, they stick, and that's very painful. Pericarditis, pericardium is around the sac around the heart, so it's in the sac that it's moving all the time, and that fluid is like lubricating it and keeping it from getting just abraded and sticking to the membranes around it. If that gets inflamed, then that can be very painful. And so peritonitis is inflammation of the fluid and the area inside the abdominal cavity where your stomach is. It's always in motion. Your GI is always in motion. Your liver, your kidneys are actually held in their own, retained in their own peritoneum, the back wall of the abdominal cavity. So they're kind of covered and isolated from the rest of the organs. So appendicitis is something that can be treated, although appendicitis is something that should get taken care of right away. So hot hip or leg pack, an ice pack to the appendix area. You can see the lower appendage on the right side, the lower part of the ascending colon. So they'll be coming right out of the small intestine. And essentially, they used to think the appendicitis was an appendage that was useless. Now they've discovered and acknowledged that it actually is a bacterial hideout where people who undergo antibiotic treatment, which we have to do occasionally from time to time, ideally you wouldn't have to, but it's a hideout. It's a safe haven for good bacteria. But sometimes that can get inflamed and infected by various things. Fever can be an indication of that, kind of a constellation of symptoms together. Appetite loss, nausea, vomiting, bloating. So not any one of these symptoms alone, but kind of a constellation of symptoms along with the pain in the lower right abdomen. So seeing a doctor is important with that, because you don't want that to rupture, because then that would be inside the peritoneum and that would cause sepsis inside of the peritoneal cavity. Having said that, there is a story that I read. I met a man in his 90s when I first moved to the area here, and his name was Andy Holland. And he wrote a book called Switchbacks, which detailed his life as a fire lookout through the summers in the North Cascades. And one summer he had gone up to his lookout fire station, and he'd gone all the way up there. The pack horse had unloaded and set out back on down the hill. And all of a sudden his lower right started hurting. And he's like, uh-oh, something's not right here. He did have telephone, radio, I think it was telephone. There was a wire strung up there. He could talk to someone down below. They just couldn't communicate with the horse packer because he was not connected. And in fact, if he had taken a ride down, he probably would have had his appendix rupture in the ride back down the mountain. But what they did tell him to do was they asked him if there was any snowpack around yet, and there happened to be. And so they said, pack your lower right abdomen with ice, which he did. He packed it with snowy ice, and that inflammation died down and went away, and he ended up spending the summer up there with that appendix having been inflamed to begin with. But he went through the summer and he didn't have his appendix out until he came down in the fall. And essentially by then it was asymptomatic. But very, very interesting. I've always kind of kept that in the back of my mind as a potential first aid if there isn't help available. Another alternative, of course, is just to go in with a healthy appendix and have it out. Some people do that when they go on long trips where there's no medical help. Not something I necessarily recommend, but it is an option, especially since God put it there. It has a purpose, and we need to probably keep those things intact. Another thing that can be helpful for is puerperal infections or acute salpingitis. And essentially that is postpartum inflammation of the uterine area, as well as salpingitis is inflammation of the fallopian tubes. So that can happen. There are bacteria that get up inside of there. And it's actually the fallopian tube fingers, interestingly, surround the ovary. So the ovary is where the egg is released from. And then it it goes into the fallopian tube, and that area is not, it's not tightly adhered. It's not floppy, but you've heard of ectopic pregnancies. That's when an egg somehow gets out of the fallopian tube, doesn't get in there, and there's sperm that gets all the way through and into the peritoneal cavity, and it's fertilized, and it survives in the peritoneal cavity instead of in the uterine area. So that's kind of interesting. So if it gets inflamed and that gets out of control, it can cause peritonitis and sepsis if that infection in the fallopian tube escapes that area. So a full hot blanket pack or a hip and leg pack, and ice to the pelvic region down near the pubic area. So those are some ways to use those pack for various different types of situations, and they can be helpful and perhaps be used to mitigate those situations. So to review this content here, you can go to preparingforthetimeofturbo.com and also have other topics such as sustainable gardening, remedies for the homestead, and some pertinent messages for the time in Earth's history are the warning of the third angel and their messages.